All right, good morning in the Americas, good evening in Asia, good afternoon in Europe and Africa. It's exactly 4 p.m. here in Nairobi. Time for Citizen TV Briefs. My name is Jimmy Mbogo. Let's get you informed on some of the stories making headlines across the country. Now, search and rescue operation in Chesongoch have entered the 4th day with impassable roads and blocked access routes, still a big challenge for teams on site. Now, the government continues to deploy aerial support to assist with evacuation and provision of medical aid. So far, the death toll from the mudslide remains at 32, with 31 injured and 19 people still unaccounted for. Survivors of the landslide continue to receive medical assistance for their physical injuries in various hospitals, while others are also getting psychosocial support from both government and non-governmental organizations. Now, moving on, police are investigating an incident in which a Form 4 student from St. Philip's Day Mixed Secondary School failed to sit his first KCSE paper after being allegedly drugged and abducted by unknown individuals. Now, the student, identified as Wycliffe Muthii, had reportedly left his home in Kiaga Village, Kanyikine Ward, earlier Monday morning, ready to begin his national exams. He was later found in Makoyo, Murang'a County, by a Good Samaritan who took him to the Makoyo police station. Police confirmed that investigations are ongoing to establish what happened and to identify those behind the incident. Elsewhere, Kenya National Examination Council officials have nabbed 17 mobile phones from students sitting their KCSE examination in 2 separate incidences in Moyale and Saku constituencies, Marsabit County. The phones were handed over to DCI for further investigation, and the matter escalated to the Sub-County Director of Education, DCC Moyale, and the SCCIO.
Mimi mtoto wangu aliamka asubuhi kama kawaida, akanjitayarisha kwenda kufanya mtihani. Ndio nikapigiwa simu kutoka shule, nikaulizwa kwani aendi kufanya mtihani. Nikasema alitoka nyumbani 5, nikaambiwa anja fika. Nikachukua hatua, nikaenda huko shule, nikahakikisha hayuko, nikachukua hatua, nikaenda police station. Alipotelea hapo kwa njia, before hata afike kwa rami, alipotelea kwa njia hapo. Yeye alijisikia akiwa Makoyo kama ajielewi vizuri. Yeye anakumbuka tu vile alijipata kwa kichaka, aliamka akajipata kwa kichaka, hana viatu za shule, hana shati za shule, kila kitu yake ya shule ilikuwa imeenda.
Now, President William Ruto now says that the National Youth Opportunities Towards Advancement Project Nyota program will benefit more than 1 million youth in the country in the next 5 years, calling on the international community to help alleviate poverty and unemployment through a global approach to job creation. Speaking when he addressed the 2nd World Summit for Social Development in Doha, Qatar, President Ruto lauded Qatar for creating job opportunities for Kenyans working in the Gulf country, calling for even better working conditions. The president also reiterated Africa's quest to get permanent representation at the United Nations Security Council as a global equalizer.
We're empowering citizens economically through initiatives like the Financial Inclusion Fund, popularly known as the Hustler Fund. To date, the fund has disbursed Kenya shillings 80 billion, an equivalent of US dollars 615 million. To 26 million Kenyans. It now accounts for more than 9.5 million repeat borrowers, including 5 million individuals who have successfully restored their creditworthiness through consistent repayment, enabling them not only to re-enter the formal credit market, but also access higher borrowing limits and better financial terms. At the same time, together with partners, we are launching programs such as the National Youth Opportunity Towards Advancement Project. Over the next 5 years, it will reach 1 million young Kenyans, training them in skills that are on demand, financing startups, and enabling access to government procurement opportunities.
Now to some good news, where Kilifi County recorded a medical milestone after a team of doctors at the Kilifi County Referral Hospital successfully delivered conjoined twins. The surgery was led by an interdisciplinary team that saw the babies delivered in otherwise good health, with initial investigation showing that the twins have separate hearts and other internal organs. They will be referred to the Kenyatta National Hospital for further management. Laura Otieno has more.
Premature labor that struck on Monday morning had Jemima Sidi wheeled into the Kilifi Sub-County Hospital for an emergency cesarean section. The 25-year-old first-time mother had, however, undergone an initial scan during prenatal visits, which showed that her unborn children were conjoined.
We were able to assemble a multidisciplinary team very quickly. With support from the management, administration, we were able to have the obstetric team, the anesthesia team, pediatricians, pediatric surgeon, as well as the nursing team, all availed themselves, and we were able to successfully conduct the delivery.
Both of them together, they weighed around 4 kilos. They were conjoined at the thorax, at the chest, and the abdomen. So basically, we suspected they are sharing a common heart and probably a common liver. So, but apart from the breathing difficulty, they were fairly stable.
Preliminary investigations, however, reveal that the two babies have separate hearts and are currently under observation at the High Dependency Unit, awaiting the processing for referral to Nairobi.
Our surgical colleagues contacted the pediatric surgical team at KNH because we were confident these babies were now stable. The next step was to make sure they get specialized multidisciplinary care.
Tokea jana mpaka saa hii naona huduma zenu ziendelea. Hata saa hii kuna safari ya kwenda Kenyatta Hospital na naamini pia huko tutapata huduma bora mpaka nitapata watoto wangu vizuri.
Conjoined twins often have bodies physically connected at birth. The condition occurs when a single fertilized egg partially splits but fails to completely separate during early development. Laura Otieno, Citizen TV.
Thank you, Laura. Some good news there. Now, moving on. Despite sitting on vast mineral deposits, many residents of West Pokot County continue to live in abject poverty, a painful reality that locals attribute to years of exploitation by powerful middlemen and lack of direct benefit from their natural resources. Now, to address the situation, the Artisanal and Small-Scale Miners Association of Kenya, ASMAC, is planning to put urgent measures in place to ensure that local communities gain tangible benefits from the mineral wealth around them. Association Chairman Dr. Okech Sala emphasized the need for structured mining systems that prioritize community welfare over profit-driven intermediaries.
So kanona hiyo ndo takayapana
hebu nikija mtakuwa mnafurahi tu. Ukienda kule mashinani unakuta wanauza dhahabu kwa bei nyingine mbovu sana. So haya yote tutakuja kuyamaliza. Wana lose almost 30-40% of the value of gold, na ni very unfortunate. Haya mambo yote yatakuja kuisha, manake tunapofungua kule tuta make sure wanaweza kuja kuyaleta yale dhahabu na waweze kuyauza kwa bei yale inaelekea na almost ya bei ya dunia ya London Stock Exchange, ya London Stock Exchange ya dhahabu na New York na Hong Kong. Price tutakuwa tunaenda na national price, so that either inapunguza kwa $1 kwa chini ya hiyo inshallah.
Pia tunashukuru mandugu zetu ambao wametutembelea siku ya leo kwa kutusaidia pia tuweze kupata hata SHA ili tupate matibabu, na tunashukuru hata rais wetu William Ruto Samoe kwa sababu ametujali kama wakaaji wa West Pokot. Tungependa pia kuambia watu wetu ya kwamba wakati mambo kama haya yanatokelezea, tunafaa tukuje tu register pamoja, tukae pamoja, tufanye maneno ya cooperative pamoja ili tuende mbele, ili tuone maana ya hizi resources ambazo Mungu ametupea kwa hii wakati.
Now, the government says all pending dues owed to sugar factory workers and workers' salary arrears will be settled. Speaking after meeting sugar sector stakeholders, Agriculture Cabinet Secretary Mutahi Kagwe said payments have already begun, adding that most workers will be reabsorbed by private operators and directed all leased mills to resume full operations immediately. Kagwe also warned against unauthorized weigh bridges to ensure fairness in the sugar sector and better returns for farmers.
This office is always and constantly remembering what they are doing and the fact that they are important Kenyans, and we will not let them suffer. We will not rest until everything that is due to them is handed over to them.
Now, from agriculture to health matters, where the Ministry of Health has received a major boost in efforts to expand oxygen access across the country following the flag-off of a new consignment of medical equipment funded by the Global Fund. The fully funded consignment included 470 patient monitors, 10,000 wall outlet flow meters, and 612 oxygen analyzers to be distributed across hospitals in all the 47 counties. Speaking during the flag-off, Health Cabinet Secretary Aden Duale said the initiative marks a key step in strengthening the country's health system and advancing universal health coverage.
And we are providing a reliable medical oxygen. And this we are not doing it for the sake of it. Oxygen bridges promise and practice. It's very vital in our emergency care, in our maternal and newborn care, surgery, intensive care, and also during outbreaks. We have installed 14 bulk oxygen tanks, delivered over 1.2 million kilograms of liquid oxygen, and distributed more than 20,000 oxygen cylinders.
The consignment that we see here today, comprising of oxygen plants, maybe concentrators, cylinders, it will expand access across facilities, from referral hospitals to the last mile. And this will reduce preventable deaths from pneumonia, surgical complications, maternal emergencies, trauma, and critical illness.
Now, from health to diplomacy matters, where Kenya has officially inaugurated a Consulate General office in Jeddah, Saudi Arabia. A move expected to serve more than 160,000 Kenyans living in Jeddah and Makkah region, 4,500 Hajj pilgrims and over 120 Umrah pilgrims each year. Now, the inauguration was officiated by Principal Secretary for Foreign Affairs, Dr. Korir Sing'oei, alongside Saudi officials and representatives of the Kenyan community in the kingdom. The PS described the move as a significant step towards enhancing Kenya's commerce, investment, labor, tourism and education ties with Saudi Arabia. Now, Coast Nat officials are now threatening court action to block government's plan to move teachers from the Minute medical cover to the new Social Health Authority, SHA. Nat Coast Secretary, that is Secretary General Dan Olo, says teachers have contributed over 21 billion shillings to Minet and fear that the funds may be mismanaged if they are transferred. Nat argues that SHA still struggling with multiple challenges and wants the government to consult the union before implementing the directive on December 1st.
Rural, urban, private hospitals hawajasikizana na serikali. Bado wanadai sasa walimu hao 450,000 pamoja na watoto na familia yao karibu 1.8 million watahama mara moja kwenda kwa SHA bila mpangilio.
Saa hii kwanza bado kuna matatizo ya watu aminate. Kuna maswala ya pre-auth. As I'm speaking, kuna walimu kama 5 sasa hivi wamenipigia asubuhi bado hajakuwa pre-auth. Kama kiwa innate iko vile na sisi tumekubaliana nao muda mrefu, leo tunachukuliwa kiolela, tunawekwa kwa SHA. Sisi kile tunaongea lazima kwanza tuweke kwa meza, tuzungumze. Hatuwezi kukubali kuchukuliwa kwa SHA bila kuwa na mkataba rasmi.
All right, and that's all we have for you at this hour. More details will be coming your way later on at 7 and at 9 p.m. Thank you for watching. My name is Jimmy Mbogo.